About to get started, everyone. Thank you all so much for being here. I can't believe how many of you are here. This is really exciting for me, so thank you. We're going to go ahead and get started. My name is Danny Nierenberg. I am president and co-founder of Food Tank along with Bernard Pollock. We are a research and advocacy organization devoted to really highlighting stories of hope and success in our food and agriculture systems. And we do this with the aim to inspire, motivate, and ultimately activate positive transformation in how we produce and consume food. I am so excited for this event, and for those of you tuning in online, welcome. For those of you in the room, thank you for being here. We are excited to be co-hosting this with the Tufts University Food as Medicine Institute, and the theme is improving health while managing healthcare spending, enter food as medicine. And there's no more important time to have today's program. About half of all American adults are experiencing one or more preventable chronic diseases, and many of these, unfortunately, are related to their diets. The toll this takes on eaters' quality of life and well-being is immense. It also takes a toll on the economy. The Centers for Disease Control and Prevention estimates that diabetes costs the healthcare system $173 billion per year. High blood pressure costs an estimated $219 billion annually, and heart disease and stroke cost the healthcare system $254 billion per year. But thankfully, there are many solutions. And I am so excited about the agenda we've put together, which brings together members of Congress, medical professionals, food as medicine thought leaders, advocates, folks with lived experience, and other experts to talk about the power of food as medicine and how it can help us manage healthcare spending while improving the health of eaters. So I want to thank Dr. Dariush Mazafarian and Emily Callahan of the Food as Medicine Institute at Tufts University. They are great collaborators, and this event would not be possible without them. Please give them a round of applause. I also want to thank U.S. Congressmember Nicole Malliotakis and her office for providing the room for today's luncheon, so give them a round of applause, please. And most importantly, thanks to our production crew and all the food service folks who have made sure that you are well nourished today. At least I hope you are, so give them a round of applause. It is now my honor to introduce somebody I consider a friend and a mentor, and that's Dari Mazafarian, the director of the Food as Medicine Institute at Tufts University, who will say a few words. Give him a round of applause.
Thank you, Danny. It's really a pleasure to be here. My name is Dariush Mazafarian. I'm a cardiologist, and I direct the Food as Medicine Institute at Tufts University in Boston. Thank you to Danny and to Bernie and Kenzie and the whole Food Tank team for their partnership in pulling off this event. If you're online, there are thousands of people online watching this right now, and this is the largest room we could find and we could request. And so if you're in here, you know it's packed, and we're all close friends and closer friends after this event. So thank you for being here and for patience with the small space. It really is standing room only. I think I just have a pretty simple message to add to Danny, what Danny said. The time has come. The time has come to fix our food system. And right now, in the House and eventually in the Senate, there's arguments about reconciliation and finding $1.5 trillion over 10 years and how they're going to do it and what's going to be cut. I have a very, very simple solution. We need to fix food. It's estimated that over $1 trillion in preventable healthcare spending and lost productivity happens every single year from poor nutrition. And so if we just recapture 20% of that, that's over $200 billion a year we can bring back into the federal budget, into the U.S. economy, and easily pay for all of the priorities of both houses of both parties and the administration. So this is the fundamental issue of our time: to make a healthy nation, to have healthy children, to reduce healthcare spending, to have farmers who have vibrant livelihoods, to increase the good use of our resources. Food is really medicine. Food is not only medicine. Food is also dignity and joy and culture and family and taste. But food is actually literally medicine. It's biologic information we're putting into our body that can heal us or poison us. And unfortunately, the latter is happening all too often. And so I'm really, really pleased to be here. I think we have a terrific lineup of congressional speakers. Are you going to introduce our first speaker? And so I will turn it back over to Danny to introduce our first congressional speaker. Thank you.
Round of applause for Dari, please. Again, incredible to collaborate with Tufts Food is Medicine Institute, and a real honor to have Dari here. It is now my pleasure to welcome to the podium U.S. Member of Congress Buddy Carter, who represents the 1st Congressional District of Georgia. Give him a round of applause, please. We're just going to wait a few minutes while Buddy can join us. Again, this is a really incredible time to be having this program. I can't believe how many of you are here. I see a lot of old friends. I see some folks who haven't been in these conversations before. We're really excited to have all of you. I encourage you to network, learn from one another. I always suggest that you try to meet, some 5 people that you haven't met before. I don't know how, it's very crowded in here, so I don't know if you'll be able to do that. All right, so we're gonna start our first panel. And I'm going to invite our first panelists to join me on stage. They know who they are. So just go ahead and take your seats. Dana, Erika, and Herman. All right. Thanks for your patience, everyone. All right. So I'm really excited to dive into this first conversation to explore federal innovations in food medicine. So again, we have Dion Buchanan from the Food Medicine Institute. Now you can hear me, right? Give Dari a round of applause, please. Let's keep this energy going. I know you're all crowded. We have Dana Thomas, the Managing Director of Food is Medicine at the Rockefeller Foundation. Round of applause. Erika Hanson is a clinical instructor at the Center for Health, Law, and Policy Innovation at Harvard Law School. Give her a round of applause. And we have my new favorite person in the entire world, Herman Johnson, who is a U.S. Army veteran and a Food is Medicine program participant. Give him a hearty round of applause. Thank you. So, Dari, of course, I want to start with you. I'm wondering if you can sort of briefly describe the sort of state of nutrition security and the rate of diet-related chronic diseases that we're seeing in the U.S. today. I alluded to some of it, but you have a much better understanding of it than I do.
Yeah, we are so sick as a nation. We truly face a diet-related disease crisis. It's really unbelievable. And this has all happened not only in our lifetimes, but in my adult lifetime. When I graduated medical school in 1995, we didn't have an obesity epidemic, we didn't have a diabetes epidemic, we didn't have an epidemic of autism and poor gut health and poor mental health. This has all happened in the last 30 or 35 years, and while there are likely many causes, food is clearly at the top of the list. We have dramatically changed our food, and we dramatically changed our food to meet the needs of the 20th century, which were calories and vitamins. Those were big problems in the 20th century, enough vitamins and enough calories. But unfortunately, in doing so and in ultra-processing our food and in minimizing, minimally processed foods, we've become very sick. And so half of all adults today have diabetes or prediabetes. 3 in 4 have overweight or obesity. And if you add blood pressure and blood cholesterol levels to that list, 14 out of 15 adults in our country are sick. 14 out of 15 have a diet-related condition. So really being healthy is the rare exception now. And this happens early in life, even among teenagers. 1 in 4 teenagers has prediabetes. That should shock us as a nation. It's completely unacceptable for 1 in 4 teenagers to have prediabetes. And so I'm really excited about Food is Medicine as one important tool, not the only tool, but one important tool to reverse this really just shocking and devastating epidemic.
Absolutely. I'm going to pause right there and I invite, thank you. Give Dari a round of applause. Now it is actually my honor to welcome U.S. Congress member Buddy Carter, who represents the 1st Congressional District of Georgia, to the stage. Please give him a round of applause.
Wow, does the fire marshal know y'all in here? Holy cow. Great to see y'all. Thank you for being here. I'm Buddy Carter. I have the honor and privilege of representing the 1st Congressional District of Georgia, which includes the entire coast of Georgia, over 100 miles of pristine coastline. For your purposes, what I want you to know is that professionally I'm a pharmacist. For many years, I was the only pharmacist in Congress. We got another pharmacist now, so we're very happy to have her. So now I'm just the oldest pharmacist in Congress, so go figure. But it is an honor and a privilege to serve in Congress, and particularly in the role that I serve in, and that is as chair of the Health Subcommittee of Energy and Commerce. And it's funny, you got to be careful what you ask for. For 10 years, I've been aspiring to hold this position, and I finally get it, and they come up to me and say, oh, by the way, we're going to be doing a reconciliation budget, and we're going to look for savings, and most of it's going to come from your subcommittee. I said, thank you very much. But I am very proud that we were able, in the bill that we are discussing right now while you're here, and that we hopefully will be voting on at the end of this week in the House, that we were able to identify over $700 billion in the next 10 years of savings in Medicaid, of waste, fraud, and abuse, without cutting anyone off of the program at all. The Medicaid program is essential. It is for the most vulnerable in our society. So I was very proud of our committee for doing that. The entire committee achieved a savings of over $988 billion over the next 10 years, more than half of what we were looking to do in the entire package. So I'm very proud of our committee, very proud of our subcommittee for doing that. Now, serving as chair of the Health Subcommittee on Energy and Commerce, I often ask, well, what are your goals? What do you look to do? Our goal is as straightforward as it is consequential, and that is to help people live longer and healthier lives. We want to make America healthy again. I subscribe to what the president wants to do, what Secretary Kennedy wants to do, and that is to help people live longer and healthier lives. And we can do that. We've got to address a number of issues. First of all, chronic disease. Chronic disease impacts 129 million people here in America every year. And all of you know it. All of you here know someone who has suffered from a chronic disease. You know the cost of it. You know the physical cost of it, what it does to the patient, what it does to the caregivers. All of those things we want to try to help with. And we can do that, and we're going to do that. So we're addressing, as I say, chronic disease. That's one of the things that we're trying to address. We also want to address increased price transparency. As a pharmacist, you can imagine, I was the one at the counter who had to go and tell the patient how much their medication was. I was the one at the counter who had to watch the senior citizen as they had to make a decision between buying their medicine and buying their groceries. I was the one at the counter for 40 years who had to tell the mother how much the antibiotic was and to watch her in tears trying to figure out how she was going to pay for that antibiotic. So I set as my goal and my focus to do something about that, and we are trying to do something about that. We want to do something about it, and as I said earlier, chronic disease is one of the ways in which we're going to address this. One of the things that I think, one of the facts that is very, very informative to me and quite frankly is startling to me. In 2013, zero states had an obesity rate over 35%. In 2023, 23 states have an obesity rate over 35%. You know, you've always heard you are what you eat. Everybody's heard that before, and it is true. That's why when we talk about the fact that food is medicine, and we need to acknowledge that. Now, obviously, as a pharmacist, I believe in medicine. I used to write a weekly column, Take Your Medicine, tell people why you should take your medicine. And it is important, and compliance is extremely important. But making sure that your diet is important as well, and I have to all understand that. I want to share a personal story with you real quick. My wife and I had the opportunity, after 47 years of blissful marriage, to take a dream vacation. We spent 2 weeks over in Europe. It was just wonderful. And we told each other then, we said, we're going to eat whatever we want to eat. We're just going to make sure that we enjoy ourselves because we're never going to get this chance again. And we did that, and I felt like, oh, man, when I get back, I hate to look at those scales. I got back, and I had lost 1 pound. Now, what's up with that? What's up with the American diet versus the European diet? Now, yes, granted, we were in northern Italy, a lot of hills, a lot of walking. Okay, I get that. Exercise is important. And, hey, no kidding, I do 500 push-ups every morning. Did them this morning. Do more than Bobby Kennedy. Make sure you let him know that if you talk to him, okay? Excuse me, Secretary Kennedy. I'm sorry. But it is true. And you know, exercise is truly a big part of it. But what we eat And it hit me when my dad turned 52 and he had his first triple bypass. And I said, oh boy, I better get serious about this. And I did get serious about it. That's when I started doing I'd always worked out, but that's when I really got serious about it. And exercise is so very important, but I got serious about my diet too. I cut out red meats, and I have them once a week, but I make sure that I try to make sure that my diet is healthy, and that's what we should be doing. That's why I want to thank you for what you're doing here. Your advocacy is important. Don't think for 1 minute that you're not making a difference. Remember, this is a citizen legislature. Congress is a citizen legislature. I'm a pharmacist. As I mentioned, we got another pharmacist. We got a couple of urologists. We got new car salesmen. We got way too many lawyers. But the point I'm trying to make is that people do need to be educated about this. Members of Congress do. That's why I want to thank you for being here. I want to thank you for your advocacy. You wouldn't be here if you didn't care. You wouldn't be here if you didn't feel like you could make a difference. And you do make a difference. That's why I want to thank you for being here. I want to thank you for having me here today. I ask that you keep all of us, especially this week, in your thoughts and prayers as we try to do something to really make an impact in our country and move this country forward. Thank you all. God bless you.
Really excited to have Congressmember Carter here. It is now my honor to welcome U.S. Member of Congress, Dr. Greg Murphy, who represents the 3rd Congressional District of North Carolina. Round of applause, please.
Hey guys, good afternoon. Was Dr. Carter in here pushing vitamins? You know, the United States has the most expensive urine in the world, right? I love patients who come in and they're taking 15 vitamins, and I remember one person just telling me that all we need was a Flintstone chewable. But that said, I still take a few myself. But thank you all for doing this. I have now practiced medicine 36 years since I got my MD degree. I actually still see patients. I'm the only person in Congress that, physician-wise, that still sees patients. So this is a critical issue. You are what you eat, right? As the adage says, you are what you eat. And sadly, in eastern North Carolina, there's a lot of barbecue, and people are what they eat. And the epidemic of obesity is a tragic fault upon our nation. My wife is over in Europe now with her boyfriend, Jean-Pierre. I'm just joking about that, in France. And I was just talking to her this morning, and she just talks about the freshness of the food and how much more flavorful it is, and the fact that obesity really is not a problem in Europe. It's a real problem here in the United States. And I'm happy to see that RFK has put being healthy again back on the radar. We have so many chronic diseases, other diseases that are a direct result of our nutritional desert. I was served in our state house for a few years, and the issue of food deserts came up. I live in a very rural part of eastern North Carolina. Has anybody ever been to the Outer Banks? Yay. I get to go to the beach when I get home to the district, so it's kind of fun. But we have a very poor rural area, and in so many places, the grocery stores have left. And the only access to any type of food really is in the 7-Elevens or the Quick Marts or something else like that, and there's no fresh food there. And this is something I believe is critical, and I appreciate everybody's advocacy for this. My wife is a wonderful cook, and so I might sneak in a potato chip or a cookie every now and then, but don't hate on me. But life is about enjoyment too. But I think it's just critical that you guys bring this issue to the forefront. I'm really, really happy that RFK is doing it. I'm going to agree with most of his things. Maybe not going to agree with all of his things, but I think a nutritional reset, just like a lot of things that are going on with the administration right now, is critically needed. I look at our fast food industry. Look, who doesn't love a Egg McMuffin? I love that. And that's actually not too bad for you, on the scale of too bad for you. But we've become so dependent on easy, fast, quick food that is of nutritional value of zero. Looking at our SNAP benefits, sadly enough, so many of those on SNAP have so much that is not nutritional in their diets and provided by the government, which should not be the case. So I think, again, looking at what we're going right now, it's critical. You look at the Army and the Navy and all the military recruits can't take people in because of childhood and adolescent obesity. It is a crime on this nation that we can't do something further. So I will just say from a physician standpoint, I love to tell some of my patients, Roger, I'll see you next year, but do me a favor, I want to see less of you. And that has to do with eating. It has to do with exercise. It has to do with treating our body as a temple, as it should. So what goes in is important. And so as far as what you guys are doing, your advocacy is critical in making sure that this issue does not fall by the wayside. We have a lot of interests that want to have quick, fast food, but is not nutritious. So thank you again. This is critical to me. And the only reason I'm in Congress is to really worry about health care and to try to do health care issues. And preventive medicine, as Ben Franklin said, really is the key, and it starts with nutrition. So thank you all very much. Continue your advocacy, and thank you all very much.
All right, Dari, I'm going to come back to you for a moment. We'll get this panel started again. So, you know, one thing that concerns me, food as medicine is an ancient idea, and Congressmember Carter talked about the power of medicine being included with it. How do we do this, combine food as medicine with sort of the technological innovation and knowledge that has come, you know, so far?
Yeah, so I mean, as I mentioned, I'm a physician and cardiologist. I see patients in clinic in downtown Boston and Chinatown. We need to give medicines to the right patients who need them. We need surgeries, we need diagnostic tests, we need all the things we do, but we also need nutrition and food, and that fundamentally should be the foundation of all of it, right? We should be giving the other things after we've tried nutrition and nutrition hasn't worked. And I want to say that nutrition in medicine isn't just for prevention. People mention prevention a lot. Of course, it's critical for prevention, but it's a therapy. It's a treatment. If you have type 2 diabetes, if you have heart failure, if you have cancer, if you have poor gut health, if you have depression, if you're pregnant and you're at high risk for many complications of pregnancy, food can be used as a therapy with immediate, within weeks, a return on that investment. And so, to me, it all has to be done together. You know, we don't want to medicalize food. We want to naturalize the healthcare system. I think that's what we're really going for. And I think the one area where combining drugs and food as medicine prescriptions could be really powerful is GLP-1 drugs for treatment for obesity. We have a paper coming out on May 30th from 4 major societies talking about this in four different journals. And so, you know, we'll send that out on kind of LinkedIn for people. But I think that's really where it makes a difference, because people can't stay on these drugs long term. There's side effects, there's other problems, there's bone and muscle loss. The drugs are effective, we should use them, but they have to be used in combination with wraparound lifestyle, nutrition, strength training, other things. Otherwise, it's ethically poor, it's clinically poor, and it's economic suicide for the nation.
I love this term, naturalizing the healthcare system. Before we move on to the panel, and I promise I'll get to all of you, I would now like to introduce U.S. Member of Congress Robin Chellie, who represents the 2nd Congressional District of Illinois. Please give her a round of applause.
Good afternoon, everyone. Excuse my voice. I'd like to thank Food Tank and the Food is Medicine Institute at Tufts University for inviting me to speak today. It's great to see everyone so shortly after your 2nd annual Food is Medicine Advocacy Day. Y'all need a bigger room, though. Just last month, I toured a food pantry back in my district. It was actually in Dalton, Illinois, where our new Pope is from. So I'm proud to claim the Pope. The food pantry showed the power of access to healthy foods in a community. Many of my constituents live closer to a McDonald's than a grocery store, like most Americans. But Free Indeed in Dalton offers free, healthy food for the community. It also has supplies like diapers and household cleaning items. Despite the power of food pantries, however, they can only do so much. For every free meal that a food pantry provides, food assistance like SNAP provides 9 meals. Right now, as you know, SNAP faces billions of dollars in cuts, threatening critical support for over 40 million Americans. In my district alone, almost 190,000 people rely on SNAP to put food on the table, not because they want to rely on SNAP, but because they simply have no other choice. While SNAP benefits work to address food insecurity and serve as a baseline for nutrition, food as medicine interventions can tackle the enormous burden of diet-related diseases. Everyone, no matter where they live or their income level, deserves healthy foods that fuel their bodies and minds. And You know, I talk about the unserved and the underserved. I live in a middle income, some upper middle income community. It took us forever to get a grocery store. So it doesn't mean that you live in a low income area because you don't have access. Even people that don't have access also. Most Americans, though, have eating patterns that do not align with the recommendations for good health. In Illinois, 1 in 5 adults don't eat vegetables every day, and 2 in 5 adults don't eat fruit every day. I'm probably in that stat. This contributes to why Americans spend $1.1 trillion each year to treat diet-related diseases. The best medicine, as you know, is preventative medicine, and that includes food. Healthy foods can help prevent diet-related diseases like type 2 diabetes, heart disease, high blood pressure, and poor bone health. But we know there's more to it than just saying, eat your veggies. Last Congress, I introduced a Fueling Optimal Outcomes Through Diet or Food for Health Act. I plan to reintroduce my Food for Health Act again this Congress, and I look forward to working with my colleagues on both sides of the aisle. It was great to hear that Congressman Buddy Carter and Dr. Greg Murphy spoke about their passion for this important issue earlier. Remind them to sign on to my bill. Together, we can further prove that poor nutrition and health outcomes aren't tied to political parties, and neither are these solutions. My bill would address using food-based interventions to help prevent, manage, and treat diet-related diseases. It would further partnerships between community-based organizations and healthcare providers, including dietitians, which is why I'm so proud to have the support of organizations like the Academy of Nutrition and Dietetics, Feeding America, and Food Smart, among others. My bill truly brings together all people, including farmers and producers. Foods come from somewhere, after all, and it strengthens the local supply chain. This is just a start, and I'm committed to working with all stakeholders to advance food as medicine through every available means. Food as medicine benefits more than just a person's individual health. It benefits the economy. Tufts University estimates that if all eligible Americans receive medically tailored meals, we could save $20 billion, I said $20 billion, in healthcare costs in the first year alone. We could prevent 3.5 million hospitalizations. In Illinois, that would save over $2,000 per patient. Now that's efficient. I invite my fellow members of Congress to come together to support food as medicine programs nationwide, and I hope everyone learns from these panels today about the transformative power of healthy food into our healthcare system. Thank you so much, and I am one of your allies.
Wonderful. So glad Representative Chellie was able to be here. So, Erika, if I can turn to you, Congressmember Chellie mentioned a lot of the costs associated with this and some of the budget cuts that might happen. I'm wondering if you can talk a little bit about how Medicare and Medicaid can be leveraged to help people gain access to things like produce prescription programs, medically tailored meals, and then maybe talk a little bit about what's at risk if those programs are cut.
Definitely. Is this on?
You just speak into it.
Yeah, is that working? Okay, sure. Yeah, so we've heard a lot about kind of the possibility of these food as medicine programs, but there's actually a lot of existing federal policies that are making these possibilities a reality in, like you mentioned, Medicare, Medicaid, in pilots in the VA and the Indian Health Services that I hope you're going to hear more about from this panel and later. So, for instance, in the states that you've heard from today, such as North Carolina and Illinois, we have really great federal policies that have facilitated amazing innovations in Medicaid through what are called 1115 demonstrations or in lieu of services flexibilities, other flexibilities that have actually made it possible to pay for things like you mentioned, medically tailored meals, medically tailored groceries, and produce prescriptions, which are actually tailored food interventions to address people's chronic health conditions, make it possible for them to have access to food that help prevent, treat, and manage their chronic health conditions, sometimes with help of nutrition education, other wraparound services, as Dr. Masafarian mentioned, right? And we have two actually major evaluations of the first two programs out of North Carolina and Massachusetts that showed statistically significant reductions in emergency department visits and inpatient utilization of hospitalizations that resulted in North Carolina of savings of $85 per member per month for individuals who are enrolled in this program. So that's including the cost of the interventions and the cost of medical care. So comparing individuals who are enrolled in this program in Medicaid to individuals, comparable individuals who were not. And they actually found that enrollment in the program for a longer duration, so 12 months compared to 6 months, led to greater savings for this state. And this is not just like a little pilot, right? So in Massachusetts and North Carolina combined, this is nearly 30,000 people that had access to these services, these health-related needs services, which included things like housing supports as well. So these are major innovations that we have happening in places like Medicaid, Medicare Advantage, the VA, and Indian Health Services. As you mentioned, though, Danny, with the possible cuts that are coming this week, all of this innovation is possibly under threat, right? If Medicaid is cut, if these federal programs are cut, states and programs may be placed in a really difficult position, right? Choices are going to have to be made, and the choices that are made might be that some of these kind of innovative, cutting-edge programs might have to be cut, right? So we don't know what the future holds for these types of programs, but because they are newer, because they are kind of on the cutting edge, they are not mandatory, we don't know what's going to happen to them, but we know they show a lot of promise, right? These evaluations are huge. They are not only helping people, but they are saving money, right? This is exactly kind of the kinds of innovations that we want to see in our transformative healthcare system.
Definitely a win-win, makes common sense, makes economic sense. Thank you so much. Dana, Erika mentioned, the Department of Veterans Affairs and the Indian Health Service. So much innovation and really exciting innovation happening there. Can you talk a little bit about what's happening?
Sure. Thanks, Danny, and thank you for inviting the Rockefeller Foundation to be part of this very important conversation. And I really love the title of this panel, Federal Innovations in Food as Medicine, because the federal government is really innovating in this space. Erika talked about Medicare and Medicaid. All of the Medicaid 1115 waivers are tailored to the populations in the state. So it really is a true demonstration of how states and the federal government have partnered to innovate. We at the Rockefeller Foundation are also partnering with the federal government, and we have an MOU with the Veterans Administration to offer FIM interventions for veterans. And so we entered into an MOU with the VA in 2023 to support FIM implementation and research pilots through the VA in the healthcare system in 5 states. What's really unique about this innovation is that the VA is the largest integrated health system, I don't know if many of you know, in the U.S., supporting 9 million vets. And so we are allowed to provide our FIM interventions in concert with all the wraparound services that the VA provides, right? So medical supports, including nutrition counseling and healthy teaching kitchens. I'm excited for you to hear from Mr. Johnson to talk about his experience in this program. But it's been a real source of support for a lot of veterans who we know typically have higher incidences of chronic disease, experience loneliness, experience some mental health conditions. And so we are really excited to see the outcome of this partnership. We will get additional information or results from the research later this summer, but preliminary data shows there have been some improvements in healthcare outcomes and reductions in healthcare utilization. And so we've started these pilots in Salt Lake City, Utah, and Houston, Texas. And then earlier this year, we announced launching additional pilots in Syracuse, New York, Raleigh, North Carolina, and Maryland. And so it really is a great opportunity for us to partner with the federal government to support our nation's veterans.
Absolutely, and that partnership between the federal government and philanthropy is really so important. Or do you fear that it will be lost if changes happen this week with budget cuts?
So my hope and expectation is that we will continue to support our nation's veterans. I think anytime there's going to be a reduction in federal support, as Erika mentioned, there is some concern about the ability to keep innovations moving, but we are committed to the work that we are doing with the VA, and my sense is that the VA is committed to the work they're doing with us.
Thankfully, I'm so happy about that. Herman, first of all, thank you for your service, and I was delighted to sit with you at breakfast this morning and hear a lot about your experience with food as medicine. Can you talk about sort of the changes you've experienced as a veteran and someone who's really in this and believes in it?
Oh, I'd love to. First, I just want to thank God first, and then thank the organization, Food Tank, Rockefeller. My experience started maybe 2 years ago. I was performing a rescue through Allstate Rescue Service to a customer, and she was in her 60s, and I was beginning to turn 64, and she said something to me that just really encouraged me because I was at 300 pounds at that time. And she said, when I got down to help someone else, I couldn't hardly get up myself. So when she, so I said, what did you do? She just said, I just bypassed the cow and ate what the cow ate. And that started my plant base before I was introduced to the Fresh Connect through the VA. So after 6 months of fresh plant base, and I am a SNAP recipient, so I had to really balance that in order to be able to keep enough to carry me through the month. Then the Fresh Connect come out with a Fresh Connect card to offer fruits and vegetables for a year and $100 a month, and I had to spend every bit of it before the next month because it didn't roll over. So here I am learning all new techniques. Being a cook, I've learned to adjust to eating beets. I eat the beet, the stem, the leaves. I saute all that, and then all the other juices that I was making, and in order to be able to preserve it over a period of time, I would freeze it. And then I would even make ice cubes out of it. I bought a bunch of ice cubes and then just put it in a glass on a hot day in Texas, if you know how hot it is in there. And it carried me through the day. But it was such an experience that I lost 50 pounds in less than a year, and I still have a goal to lose 20 more, but I'm back here again, and I ain't had a chance to lose nothing. But with that said, I have been encouraged with our next panel, Ms. Krista, and being encouraged by someone. Now, it's a challenge, of course, because a lot of food deserts can't get the fresh vegetables. And you were saying something earlier about how they can order it in. And that because I like to go in and pick mine. But with that said, it has been definitely a change in my life. My knees is better. I'll be 66 this year, and I'm able to play with my grandchildren and great-grandchildren.
Let's give that a round of applause. It's amazing. And Herman, that experimentation that you've been able to do, that's really been key in helping you eat healthy and making it fun, right? Making it exciting to you.
Yes. And being a farmer, I'm a very addictive person. Addictive. It doesn't take me long to be addicted to something. Now, with that Fresh Connect come out, now I'm addicted to fruits and vegetables. I beat a lot of addictions, but now I don't know how I don't think I'm gonna lose it. I'm not gonna get this one up. Yeah. So I need my prescription fee.
Well said. Thank you. Sorry, I want to come back to you about the economics of all of this. And Congressmember Chellie gave some stats from your institute, the Food as Medicine Institute at Tufts University. Can you talk a little bit more about the economic benefits of food as medicine?
Yeah, I don't think anyone really sits back and really thinks about how much we spend on healthcare, right? Almost $1 in $5 of every dollar that's spent on all the things we buy in this country goes to healthcare. So for the average family of four, we're talking almost $50,000 a year is spent on healthcare for the average family of four, which is approaching the average family income, actually, and far more than the average family spends on housing and transportation and food and many other things. We are pouring money into healthcare. And so taking some of those dollars and using them for healthy food is not only smart and make people feel better, give them more holistic care, reduce doctors' burnout. There's a lot of benefits for doctors. But some of those programs actually save money. Not all of them, and we shouldn't expect all of them to save money. The reason I say that is so important is almost nothing in healthcare saves money. People have this impression that, well, cancer screening saves money, or blood pressure, control, or cholesterol screening control saves money. None of those things save money. They cost money. That's why healthcare costs so much, because we spend money. But we spend money to buy health. In this case, we're actually buying health and getting more back than we're spending.
Right.
That's very, very, very unusual in healthcare. One of the only other things that does that in healthcare is vaccines for children, for example. Save money and provide a return on investment. Almost nothing else does. So the fact that some of these programs actually net save money is incredible. But again, I don't think we should have that bar for all of food as medicine.
Right.
We should just expect it to be a good buy, a good value, like other things we buy. And there's many, many things we do in healthcare that are not good buys, that cost hundreds of thousands of dollars per life gained or other things. So this is really quite a striking innovation, as was mentioned by Erika, where we have an innovation that improves health, that improves health equity and health disparities, that can support local farms, that can support local food retailers and supermarkets, and can actually save money. I mean, that's unheard of. That's why I think
Right.
it's so exciting, and there's so much movement and excitement.
Yeah, it makes economic sense. It makes moral and ethical sense. Yeah, there's so much to be gained from that. Dana, because the economic case for this is so strong, I feel like you are probably encouraged by the bipartisan support, and we've seen some of that already today. Can you talk a little bit about that?
Sure. I think, I've been in healthcare. I know I look young, but I've been in healthcare almost 22 years now, and I have never seen something take off with such fervor as the food is medicine movement. I think Dari can attest. I think there is a clear understanding across political ideology that, you've heard the members of Congress say, right, you are what you eat, and you hear it, but the idea that someone could be connected to a nutrition intervention that feels good to them and improves their health is sort of a thank you, sir. The constant veteran supporter is sort of a new concept. And candidly, I came to food as medicine pretty recently. I've had, like I mentioned, a pretty long background in healthcare. But this idea has caught fire and wind because I think it is such a clear, easy thing to understand.
Right.
And so, yes, it has garnered the attention across the aisle, and we at the Rockefeller Foundation, a nonpartisan organization, appreciate the support that we've received from many policymakers, both at the federal and state level.
I'm so glad for that. Thank you. Erika, if I can turn to you, because food is medicine, it seems easy to understand, and the pilots that you were describing before, then why aren't there more of those if it's so easy to understand?
Yeah, well, I think there are a lot of them, and you're going to hear from quite a few panelists later. We have some folks from Oklahoma, for instance, who just enacted a massively presidential bill, but yeah, we hear there's some cheers in the crowd, but also this is extremely fast moving, as Dana said, right? Like, healthcare and policy is very slow to adjust, and to echo what Dana said, right, in my work as a health policy lawyer, like, this has been extremely quick moving, and it also takes a bit of a paradigm shift in the way that we think about things, right? I think it also tracks some of the other changes in thinking that we've been seeing, a shift towards value-based care. As Dr. Mazafarian said, actually buying health, right? And paying for things that improve life and longevity, right? And these are things that we have not traditionally paid for in our healthcare system or valued, right? And so just shifting that thinking a little bit takes a long time, but this has been moving actually very, very quickly. And seeing the federal policy support for this and the bipartisan federal policy support has actually been very uplifting as someone who works in federal healthcare policy and state healthcare policy. So the state, the Medicaid policies I mentioned earlier, there's 16 states that are currently piloting or trying to pilot those under Medicaid, and there's very many more flexibilities that states and the federal government are trying to do. And so I think we should take that to heart, and we shouldn't stifle that innovation. Of course, we should build in guardrails, but I think we should be very impressed with where that's going.
That's great. And the paradigm shift is happening. Thank you so much. Herman, I'm going to give you the last word. And not everyone has had the same access to food as medicine programs as you have. And I wonder what you want the policymakers who you heard speak before, who are, in this building, what do you want them to know about food as medicine programs and why they should be invested in?
First of all, it's proof that it works. There's no better witness than those that have tried it, and I've tried it. I try to live by a motto: I don't practice what I preach. I preach what I've been practicing. So I've been practicing this over the last 2 years, and I can guarantee that it worked. It's going to be a struggle for those that are making changes in their habit. I know it is, but I had a made-up mind. I was at a point to where I don't like pain, and if my knees hurt, and my back hurt, and my neck hurt, and it has something to do with weight, I'm going to try it. And then we just remember where the fruit and the vegetables came from, and that was in the beginning. So we already knew the medicine that we had in the beginning. So now we want to go back to it, and I'm beating you there.
Thank you, Herman. No one's better at preaching what you practice than you. Thank you so much. Please give these panelists a round of applause. In our next panel, we're going to talk about food as medicine and its role in the public and communication. So I'd like to welcome our panelists, starting with Evan Saris. I'm so sorry, Evan. Evan Saris, the Deputy Director of Government Relations for Kroger Health. Bigger round of applause for Evan. We also have Erin Martin, the founder of FreshRx Oklahoma. Big round of applause for Erin. We have Crystal McGaffee, who is a Food as Medicine program participant and the Community Chief Nursing Officer at Appalachian Regional Healthcare. Round of applause. Just keep it going. I know you're all tired. And Laura Carroll is a Senior Advisor for Nutrition Outreach at the U.S. Food and Drug Administration's Human Foods Program. All right, so I'm excited to dig into this panel. Erin, I'm going to start with you. Something very exciting, as was alluded to before, is happening in Oklahoma. Tell us all about it.
Yes, can you hear me?
A little closer, maybe.
Okay, no. I can speak really loud, but there it is. I think it's on. Okay, here we go. So yes, on May 1st, we passed the Food as Medicine Act of Oklahoma.
Woo!
It's super exciting. We had 5 unanimous votes on this bill, something that we can all unify around, which is what we desperately. Final vote was 76-8, and we are just so excited. We definitely pointed to North Carolina, Massachusetts, and we had some critical things that happened that culminated. Stars really aligned for us. This senator actually introduced this bill 6 years ago, and people thought he was crazy. And he actually lived in a blue zone, so we had quite a champion. And we got the TA technical assistance from Erika with Chellie at Harvard. We have a coalition of over 150 members across the state of Oklahoma. I co-lead that coalition, and we have a great program, a blueprint for the nation that people can really point to in Oklahoma, something that we can be proud of. So we're so excited. This requires the managed care organizations. We have 3 in Oklahoma. We actually just celebrated a year anniversary of those managed care organizations, managed care in Oklahoma. And so it requires those managed care organizations to pay for nutrition supports, grocery provisions, case management, and nutrition education and counseling.
What else, Erin, will help make it as effective as it needs to be? What do you need to make it really, game-changing?
Yes. We did not have funding attached to this bill because of not knowing what was going to happen with the 1115 waivers. There was a lot of people not feeling unsure about putting that on the 1115 waiver just because people were unsure. But that gives us a federal match and really would give us the ability to capacity build and keep those dollars in Oklahoma and community-based organizations. And we actually prioritize locally grown food in that bill. So we need to do thank you very much. Yeah, we source all regeneratively grown fruits and vegetables. If you don't know what that is, I'll tell you more later. But we really need support at the federal level. Like what's kind of been discussed now is that we are a USDA GusNIP grantee. And that has helped us scale, that's helped us test different innovations and practices. And that funding has been paused and delayed. Right. And that's something that's critical for this to continue, for these programs to keep innovating. And we need it in the 1115 waiver so we can really expand these programs and save the state hundreds of millions of dollars.
Yeah, and again, common sense stuff going
Right.
on here. Crystal, if I can turn to you, you have been sort of amazing at combining your professional life with your personal life, and like Herman, have a really sort of a wonderful experience to share. Can you talk about your journey?
Absolutely. So I'm Crystal McGaffee from Paintsville ARH. In 2021, our team was able to join the ARH team. And from that point, from day one, ARH and its leadership team have been forward moving with the health and wellness of its communities, its employees, and its patients. Through ARH, I've been able to join a CSW, which is Community Supported Agriculture, where ARH was able to subsidize 50% of the cost to employees to be able to receive fresh fruits and vegetables. We were able to prepare healthy meals and share those on a hub where everybody kind of takes part and takes pictures. We were able to participate with GSW and doing a video with Kitchen Shift, where we did a video to demonstrate healthy eating with Beth Cronenberg, which was produced. ARH has invested so much in its employees that we have free gym memberships for every single employee at our facilities. Employees are eligible to participate in grow gardens, where we grow locally at our facilities. There's either a garden or a raised garden that employees are able to grow fresh fruits and vegetables and take those home as needed. They provide a nutrition nook where people can go get health advice, gardening advice. One of my favorite things is every year we do with Holly is a hike with Holly, where all of our facilities come together and we do a hike that demonstrates healthy eating. We do hike together, all of our hospitals together do that. This year we did some yoga in with that. There's always healthy eating demonstrations at those. And that might all sound like a lot of things that are just things, but together, through the last 2 years, with all of those benefits that ARH provides for me, I have had a successful 110-pound weight loss. So very instrumental. Herman and I both, I know that we're just one voice in a crowd, but we could be one voice of a million different people across the nation who have the same opportunities to do so. With that, when we talk about healthcare savings, at the beginning of my journey 2 years ago, I was on heart medication, I was on blood pressure medication, I was on GLP-1s and had been diagnosed as a diabetic. I'm no longer on any of those medications, thanks to being able to correct that with food.
Thank you so much for sharing your personal story. And as Dari alluded to earlier, it has to be a combination of like lifestyle changes. You mentioned gardening, you mentioned yoga. All of these things really contributed. Can you talk a little bit more about, what that meant to you to have those additional activities sort of as you're going on that food as medicine journey?
Absolutely. Herman talked about a lady that he was with that couldn't get up off her knees. I was a lady who was tired of being tired. I worked a lot with Beth Cronenberg, and we did a lot of nutritional education with her. Started going to the gym, started feeling better. The more that weight falls off, the easier it gets. And the more program availability that you have. ARH is so dedicated to offering those things, and their leadership team is really dedicated to making sure that we have the things that we need to be successful. So I truly appreciate that. But moving forward, I mean, it can be done by anybody. I was a 255-pound lady who thought that, next week wasn't going to be so easy. And now I wake up with a new dedication to life.
And I can attest to, she has a lot of energy. She's great. Laura, please give her another round of applause. Laura, my good friend, it's so nice to see you. I want to turn to you and get your perspective and ask you a little bit about how the private sector is working alongside government to support these programs. We heard a little bit about it earlier from Dana at Rockefeller.
Yeah, no, it's a great question, and I think FDA is very committed at this point in looking at public and private partnerships, right? There's a lot that we have influence on at federal government, but there's only so much that we can do, and so that is where the value comes with collaborating with those who are outside of FDA as well. One of the best examples that I can give right now is with some of our work with Instacart, which is actually part of HHS's larger Food is Medicine initiative. So some of you may remember back in December that we finalized an updated criteria for the healthy claim. So this is when a manufacturer of products can use the term healthier on their labels, they have to meet certain requirements. And it was 30 years old. It was very due for an update. So we're really happy to have that out and available now. It can be used. It is officially in effect as well. And back in December when we announced the updated healthy claim, we also announced our partnership with Instacart. So we are working with them to create a virtual storefront as well as a virtual tag so that it is easier for people to find those products that qualify for healthy. So that is hopefully just the beginning of ways that we will be collaborating with those beyond federal government. Healthy is obviously something that is primarily designed for product labeling, but there are lots of ways to use it beyond that, thinking about food as medicine initiatives and approved product lists, thinking about nutrition profiling systems, incentives for consumers when they're going grocery shopping. So lots that could be uncovered there that we would love to explore.
So much opportunity there. Yeah. And Evan, that leads me to you. There's so much opportunity with what retailers are doing to help people like Herman, to help people like Crystal, to help all of us to really get access to healthy foods. What's needed to scale that further for a company like Kroger?
Yeah, well, I think one of the great advantages for us is the access piece. So 2,700 locations across 35 states. We are in people's communities. And when our president of Kroger Health was looking at this situation, she said, we want to fill fewer prescriptions. And when you look at how prescriptions are filled, most of it is maintenance medications for chronic diseases. And all of those primarily start with good nutrition. So we're already in communities. And now we're looking at how we can provide the education and the tools for people to make the change that you have suggested you definitely wanted to do, and you did. And one of those is our Opt-Up Nutrition program. So we designed a system that's powered by something called the Food Health Score. Mm-hmm. And it is an in-your-pocket tool to give you a very clear, accurate description of everything that you're purchasing. And we will be able to tailor that to your nutrition goals. So whether you have a specific chronic disease, you want to lower your A1C, or you want to reduce the amount of sodium in your diet, you'll be able to do that. And ultimately, the goal is you can tie that score into an electronic health record, with your consent, of course. Mm-hmm. And then your pharmacist, who's in the community, and you see on average 1.6 times a week in the grocery store, you see them far more often than you traditionally see your physician. And they can help you mitigate through any issues you're having with your diet. So the tools are coming, yeah, and we're really excited to implement those with folks.
Absolutely. It's so important. I'll come back to you in a minute. But Erin, if I can come back to you, you recently told me that value-based care contracts are an important tool to value and incentivize the uptake of food as medicine. I don't get how that works, and I want to understand from you.
Food as medicine should be fully integrated as a healthcare intervention and not based in charitable outreach. This is treating chronic disease. It's not managing something that we can actually reverse. When we reverse diabetes in 8 months, people coming off of all their prescription drugs, and we're saving the managed care organizations, insurance, health systems, a lot of money. And the community should get that back. And so should the farmers who really worked so hard for this. And it's been really great to work with Ellen Brown, who's in the room, who really trained me in understanding my value and our value as a program and what we're producing and how we've scrounged together philanthropy dollars and produced all this healthcare cost savings. And so value-based contract, we have been moving away from fee-for-service. So why would we align food as medicine with that? We should be aligned and incentivized through outcomes, and that's paying for the full program, a price per month per patient, plus value-based care outcomes based on A1C reduction, blood pressure reduction, and we're really proud to say we have a contract, the first in Oklahoma, with that.
Right on. Thank you. Thank you. So great. And again, common sense. All of this makes perfect sense.
Yes. Yes, it's not a side, it's not just for you to keep members on your plan.
Right.
It's to really treat and reverse and prevent disease. And you're going to have so much more savings than you can even imagine with that, and community around that.
Absolutely. Crystal, you talked about the workforce wellness initiatives that have really helped you. I feel like those have, I know they've had impact for your family personally, but they're going to have intergenerational impacts because you're sort of building, your children will carry these on. Can you talk about, why that's important?
Absolutely. One thing that we're doing, or that I've set forth to do this year, is our community-based action plan, is to reach out to college students. We're going to do some videos for healthy eating on a budget. Another place that I always talk about and I'm very passionate about and see impact is our wound care centers. Our wound care centers are ridden with diabetics who are in wheelchairs, who can't walk, who have non-healing ulcers on their feet that just don't get better. A lot of that's understanding nutrition. And if you don't know what to eat, you're not going to get better. If we reach out to those people and we teach them what to do, we've watched it in our wound care center. We have a fantastic diabetic educator, Ashley Webb, who does a lot of outreach with those diabetic patients in teaching them how to eat, what their diagnosis means. ARH provides those patients with a food basket to go home with, to recreate the meals that they're eating, with food cards. These people can heal their problem if they are educated and they have the foundation to do so. So I feel like that makes a huge change if we work with our young people and we teach people about their diagnoses and that medication's not always what's going to correct their problems.
So exciting. And if you don't know what you eat, if you don't know what to eat, you won't get better. But if you do know what to eat, you will definitely get better.
Food is definitely medicine, and I'm definitely, Herman and I both, living proof of that. Like I said, we are a couple of voices that are millions of voices across the nation if the availability is there.
Round of applause for her, please. It's really inspiring. Laura, to help eaters, all of us, but not just Crystal and Herman, but so many of us, we need to ensure that physicians know what they're talking about, that they're well equipped with that information. And a lot of physicians just don't receive about 1 hour of nutrition education. That's changing. But how can we, support healthcare providers and getting that education, even if they've been a doctor or for 20 years or so?
Yeah, the number one trusted source for nutrition is doctors, yet they have very little to no education in nutrition. So it's certainly an area of need of improvement. We at FDA have a couple of things going on. One is we have worked with, again, public-private partnerships, have worked with the American Medical Association as well as AAP to develop CME videos for physicians, pediatricians, other healthcare professionals on what the updated nutrition facts label is and how to talk to their patients about it so that they have a better understanding of how they can direct them towards how do you read the label, what is going to be the best picks for you. But we also know that there's these quick signals that are really influential to consumers, and we can be doing a better job of giving a snapshot of information in a few seconds. So that is where things like the healthy claim comes in, but our work on a front of package labeling. We did put out a proposed rule earlier this year, so it's open for comment if anybody wants to share their thoughts with us. But that could, again, also be another easy tool for physicians and healthcare professionals to point to their patients to on look for XYZ on the label when you are looking for certain foods for prevention or thinking about chronic diseases that they may have.
Front of label packaging, I feel like, is so exciting. It doesn't get enough attention. It doesn't sound sexy, but it's going to be really helpful for physicians, for all of us as eaters.
Yeah, I would say generally most people don't find labeling super sexy, but it is incredibly impactful. It actually has this really interesting dual impact, right? You're providing consumers with information, which can help inform their choices, but on the back end, it can also motivate industry to reformulate their products. And one of my favorite success stories is on trans fat, where we required trans fat to be labeled on the nutrition facts label back in 2006. We then saw a drop of consumption of trans fat by 80%. And that was due to consumers choosing different products, but then also industry reformulating.
Exciting, exciting. Thank you so much. Evan, I get to end with you. You and I had this great conversation earlier about how you're working with your competitors, and that's really important for scaling food as medicine. Can you describe what you're doing?
Yeah, so last week, Kroger hosted a first-of-its-kind Nourishing Change conference in Cincinnati. And we brought all of our competitors together to talk about what we could be doing as one to increase the access that we've been talking about all day today. It was a tremendous opportunity. We walked away with a lot of new ideas, not only how to operate in the private sector, but also how to engage with government to bring the change that we need to mostly get providers reimbursed for these services. You know, Laura mentioned that we need to get more nutrition education in medical colleges. I would push back a little bit and just say, I agree with you, but we have hundreds of thousands of fully qualified registered dietitian nutritionists willing and able and ready to provide that service on a regular basis. They need the reimbursement. They need state scope of practice to catch up with where we are in our nutrition journey and allow them to practice up to their full potential. Get the pharmacists involved, allow them to be reimbursed for social determinants of health and providing access to that through a referral. Congresswoman Chellie was being humble in only mentioning one bill she's been working on. I have to also mention the Medical Nutrition Therapy Act, which should be introduced again in a month or so, increasing access to seniors with the most chronic diseases to dietitian services. It is a very limited benefit right now, and this very simple bill would expand that access, especially we mentioned all the increased access in GLP-1s and the importance of nutrition being coupled with those. The dietitian is perfectly positioned to do that.
Thank you so much, Evan. We are sadly out of time. Please give a round of applause to these panelists. We could have gone on for a long time. Thank you all so much. We now get to turn to a really interesting conversation about what it looks like to implement food as medicine programs. Moderating this session will be Dr. Dariush Mazafarian of the Food as Medicine Institute. Round of applause for him, please. Joining him, we have Holly Harris, the President and CEO of Appalachian Regional Healthcare. Round of applause. The dapper Dion Dawson, the founder and chief dreamer for Dion's Chicago Dream. Give him a round of applause. Dr. Kofi Essel, the Food as Medicine Program Director at Elevance Health. Round of applause. And Pam Schwartz, the Executive Director of Community Health at Kaiser Permanente. All right, Dory, my friend, over to you.
Thank you so much. I have a terrific panel, and then after this, we have a couple of congressional speakers as well, and then we're gonna close. So, you've seen the cross-sectoral support for food as medicine, the cross-national support for food as medicine. This panel, I think, also really brings that together. I'm not going to introduce each person individually. They'll talk about their own experiences a little bit. I'm going to start with Holly. As the leader of a healthcare system in Appalachia, serving low-income Americans in Kentucky and West Virginia, she's been really doing a lot about food as medicine. Why are you passionate about food as medicine? And tell us what it has taken to do a systematic approach for your employees and also for your patients.
So thank you, Dari. Thank you for having me here today and looking forward to this discussion with this great panel. So I'm Holly Harris. I'm the president and CEO of Appalachian Regional Healthcare. We have 14 hospitals across eastern Kentucky and West Virginia, about 95 clinics. We operate home health, DME, retail pharmacy, and a couple medical spas as well. And we serve a very rural population of about 350 to 400,000 people. And we see some of the sickest patients that you can imagine in the United States of America. We have the highest rates of obesity and diabetes that exist in this country. And the mission of our health system has always been to improve the health and well-being of the population that we serve. And honestly, when I became CEO about 3 years ago, I realized that we had failed that mission because we had been solely focused on sick care because of the reimbursement models that exist in healthcare. So we have really been working hard over the past 3 years to reverse that model of care and focus on the front end of healthcare and making sure that we are changing the lives of not only the patients that we serve, but starting with our own workforce. And that has been our true systematic approach, is making changes with our own employees, implementing wellness initiatives, teaching them about food and nutrition, supporting our doctors as they get certified through the American College of Lifestyle Medicine. So we have really had to break down the whole system of healthcare delivery and find those gaps that have existed. So it's been a challenging time, and hopeful that conversations like this will draw more national attention and help us start changing the reimbursement models for providers.
And you've seen immediate results already with your employees and their healthcare costs. Can you just really briefly talk about that?
Yes, so we are self-insured for our healthcare plan, and our costs have gone down. You all just saw Crystal here. I'm so proud of her and the lifestyle changes that she's made for her and her family, and she's just one example of the workforce that we have across ARH. Our employees are happier, they're more productive. We have changed all of the cafeteria operations. We're labeling our food. We have salad bars. We're doing what we call hikes with Holly. I organize hikes and take my employees out hiking after work. So it's the little things. And as soon as we see our employees start to see those lifestyle changes, it's just catching momentum. And there are a lot of crystals out there across the ARH system.
That's wonderful. You talk about the little things. The congressional cafeterias have actually improved quite a bit over the years. There's actually some healthy options, but I will give a plea to all the staffers to clean up the junk food when Americans walk into your offices and there's a bowl of candy or junk food. Congressman McGovern has done a terrific job with dark chocolate and pistachios and some other healthy choices. So we got to do the little things, even in the halls of Congress. So this panel is really about the front lines, and there's few more favorite folks I can think of on the front line for me personally than Dion. So Dion, tell us a little bit about your background and how you arrived at the work that you do, but what you're doing in Chicago.
Absolutely. I also want to add to the historical record that Kofi is also dapper. So just wanted to, but no. Okay, I'm going to speak loudly. Try this again. Everybody's mad at me. All right. I'm going to not get too excited. I'm sorry, Kofi. I saw what you did there. Dion Dawson, Chief Dreamer and founder of Dion Chicago Dream. Just a background about me. I fit a lot of different categories. So when we're talking about this work, I'm a black male from the south side of Chicago. I'm a Navy veteran. I'm a nonprofit founder. And we have implemented and scaled a lot of food as medicine work. And so just from my vantage point, I'm able to, not only listen, but also make sure that I'm encouraged and intentional about how all of these things connect. A little bit about what we're doing in Chicago. We started an organization less than 5 years ago, not focused on food as medicine, not focused on food insecurity, but just trying to have some type of response in the pandemic. But the good thing about all of this is that if you actually pay attention and hold yourself accountable to having tangible impact, then you're going to start learning more and more. You're going to start asking yourself, are we being as impactful and as efficient as we could be? And every time myself, my Vice President Danielle, and the rest of our leadership team would ask that question, we realized that there's more we can do and there's a lot of tweaks that we could make. And so what started with the community fridge in Chicago with $20 has morphed into a $7 million organization that employs people from the community. We've actually never recorded a single volunteer hour. We're providing about 200,000 pounds of fresh produce that we purchase, pack, and deliver. So we've provided about 4 million pounds of fresh produce, and we've never utilized anything that has been used. And so we actually are active players in the market. We understand the economics of it. We don't shy away from some of the capitalistic values that we have to hold in order to be successful, but we hold ourselves accountable to ultimately trying to have people live longer and healthier lives. And so in doing that, what started with a direct-to-home, direct delivery project and pilot on 2 blocks in Chicago has now scaled to us delivering in 170 zip codes and 4,300 households per week. And in doing that, we have also implemented internal community health workers doing bi-weekly qualitative touch points so that we can understand how they're initially responding. We partnered with Food Smart to make sure that we can track outcomes as we're doing that. And also, even with our partners at American Diabetes Association, we've been able to do a lot of different research in terms of how that's affecting people. And so on one hand, I'm always excited to be here. On the other hand, I'm extremely confident in what we've been able to do. This is not a pilot anymore. We've been able to scale it and sustain it and do it in a way where we really understand that in order to land this moment, food as medicine cannot be on top of a broken food system. So what we've decided to do was, while we're scaling food as medicine, fix last mile delivery so that we can have as many insights as we need to. And we've been able to do that in Chicago in a way that has not only been transformative, but it's allowed our work and our strategy to connect to the regional and federal levels. And so it's really exciting.
So you're supporting health, you're supporting local farms, you're delivering food to people in need. Talk about the mix of funding, charitable versus healthcare funding, and how that healthcare funding has ramped up, and what would be helpful briefly to make that grow.
Oh, absolutely. Anybody in here that can write a check or do an MOU, see me after, please. I think that ultimately, when we talk about sustainability, we always shirk at the idea of making money because we want to put ourselves out of business, right? Well, that's not going to happen. We are unhealthier. We're staring down the barrel of potentially more years of what we just came from in terms of households and the cash that they have on hand. And so in doing that, when we started, of course, it was a traditional nonprofit. Whatever grants we can get, we just go for it. But ultimately, and connecting with the food as medicine work, what we've been able to do because we have the fresh produce and we can procure and we can deliver, we've been able to collapse two parts of that supply chain. And so going over the last 2 years, growing our earned revenue from 0 to $500,000 to $2.1 million, and then using that to stabilize all of the offerings that we have.
From healthcare dollars.
Yes, absolutely, absolutely. And so that's allowed us to continue to grow and stabilize it, because I think ignoring the market opportunity is kind of what got us here. I think we have to balance those things out.
Yeah. Thank you. And so another one of my favorite frontline champions, I had something to do with the panel, so a lot of the people here are my favorites. So Kofi, Elevance Health is one of the largest payers in the country, covering, I may get it wrong, 45 million lives, I think. Really tremendous, almost 1 in 6 Americans. Why does Elevance Health care about food as medicine? Why are you the food as medicine director at Elevance?
Yeah, great question. Great to be here today. Really excited to talk about some of the work we're doing. The way we kind of think about food as medicine, it starts and ends with us with this concept of whole health, right? Whole person health. How do we think about the factors that influence health outcomes inside the clinic and outside the clinic as well, recognizing that these factors are key in influencing short-term and long-term health outcomes. We've seen our members, our patients, our families asking for these kind of programs. We've seen the impact of these programs. We see the data. We see the skyrocketing rates of these chronic diseases, these diet-related chronic conditions, and we wanted to respond to that. Food as medicine has been something we've been doing for many, many years at Elevance Health, but more recently, we've really focused and gone away from just primarily thinking about it through sort of an anti-hunger lens to more thinking about it through that really, truly food as medicine, diet-related chronic condition lens as well. When we talk about food as medicine, we usually use a definition like this. These are strategies or interventions that work alongside healthcare, that give access to high-quality, nutritious foods, focused primarily on 3 things. How do we prevent, how do we manage, and then how do we treat disease? We heard earlier, we can even talk about how do we put diseases into remission. Something in medical school as a community pediatrician, we didn't talk much about. I knew how to slow things down, potentially, but how do you get at the root cause and actually heal conditions? What a lot of us went into this for. This is an opportunity that we can't turn away from. When we think about food as medicine, our approach at Elevance Health, we have sort of 3 main goals. Number 1, we want to implement food as medicine through every single line of business, commercial, Medicaid, and Medicare. Right? We don't want to just hyper-focus on one line. We think that's critically important. We want to make sure we are advancing a digital-first approach, when possible, to food access and education. High-quality education, high-quality food access throughout the region, city, zip code, county, wherever we can. And last but not least, we want to lean into advocacy. But the way we want to lead into advocacy is in a few ways. We want to invest in research, building a stronger business case, invest in education, creating dynamic partnerships with phenomenal community-based organizations like many of you all in the room right now, and make sure we're advancing the thought leadership in this space as well. Our foundation has also been a key contributor to this work, thinking outside of the realm of just our members. In the last 3 years, we've supported Food is Medicine with over $30 million, and we're actually about to re-up that in the coming months as well with more investment in Food is Medicine because, again, it works, and we want to see it continue to scale around the country.
Thank you, Kofi. I think, when you have one of the largest payers in the country really believing in this and trying to scale it, you show that there's real value here. And so speaking of large healthcare, Pam leads community health at Kaiser Permanente, which is one of the largest integrated health systems in the nation across 14 states and D.C. And so similarly, as I asked for Kofi, how do you see Food is Medicine? How do you think about leading Food is Medicine across Kaiser Permanente?
Thanks, Dari, and it's such an honor and a privilege to be here and to see so many familiar faces in the audience, and I'm sure online as well. And I could say ditto to a lot of what Kofi said, and probably a lot is because we've been working together on really transforming the way we treat and prevent diet-related disease and address hunger as a nation. And I think the reason that there is standing room only in this room is because that's something we all have in common, and more we're seeing food is medicine woven into the fabric of healthcare. So I think I'll answer your question a lot with a ditto of what Kofi said, but I want to add one piece because I think there's something missing from the conversation that we've had with all the panels so far, and I just want to emphasize that for healthcare to fully embrace food is medicine as standard practice, so in a sustainable, scalable way, we have to continue to build the evidence and the business case about what works and under what conditions. And Kofi mentioned it, but I just want to put a pin in it because while the evidence is much better than it has been and a lot better, still we need to make sure we're focusing on the right disease categories, the right target populations, and with the right interventions and for the right durations to get to the impacts that we all want. And so to maybe just put a pin in more answering your question, Dari, we're trying to marry the evidence and watch how it evolves, with the best practices that we learn from our partners and ourselves. We're trying to build the evidence, and also we're trying to listen to our members and patients and communities about what matters to them, and then build investments and interventions that respond to all of that. And together with Tufts, we're leaning in, co-creating a Food is Medicine toolkit to really put pen to paper in a very practical, pragmatic way on how can we help health systems like us and community clinics and everything in between with what does it take to deliver food as medicine on the ground. So what are the practical interventions, what's the evidence-based, what are the tools and best practices, and give something back to the nation to really make sure that we're all implementing with quality, with evidence, and with and not reinventing the wheel as we deploy this across the nation. And what I also want to say, and you've heard this through all the panels, is there is so much enthusiasm in the nation for this work. We heard it from everyone, and I'll just add that it's in my own organization as well. I have been at Kaiser Permanente for 25 years. I hit 25 years like in 3 weeks, I think. And I have never seen so much enthusiasm for a topic area. An all hands on deck approach, and really wanting to figure out how we can lean into this, what's the best evidence, who are the right target populations, and how do we embrace this inside healthcare in a meaningful way and a cost-effective way. And the way to do that is making sure that we're using the best evidence, learning as quickly as possible, and also building the business case for what works and under what conditions, and then translating that into standard of care and workflows and making sure that it aligns with what our members and patients want as well. So I have so much optimism for what's possible here, and I think all of our panels demonstrated different versions of that, but I just wanted to add the importance of the evolving evidence, but translating that into practice in a sustainable way.
Thank you, Pam. And talking about the business case, Kaiser and Tufts have together, with Elevance as a member, founded a national network of excellence, bringing together some of the largest payers, insurance payers in the country, who are together, in a non-competitive way, saying what is the business case and how can we really advance this? And then I think the second point I want to make to what Pam said about the evidence. Right, we know nutrition works for reducing diet-related chronic disease. There's been dozens and dozens of randomized controlled trials that have shown many, many benefits. So really, it's now a question about implementation. And I think about, as a doctor, blood pressure lowering medications. When the first trial was done and showed that, giving somebody a blood pressure lowering medication lowered their blood pressure and prevented stroke, the drug was approved. And now we've had 50, 60 years of science to try to understand who do we give it to and what dose, what combinations, how do we get people to take it, how do we improve compliance. But the whole time the drug has been paid for and allowed that research to take place. It's time to do that in food as medicine. We don't need to figure out 60 years of implementation science to get the treatment approved. The treatment should be approved, paid for, covered, and then really determine who it should be for. So I think we have about 1 minute each for kind of quick answers. I'll just go down the line and say, ask each of you a question. So Holly, given your payer mix and the region you serve, what are the barriers to the food as medicine programs, and where do you go from here, particularly thinking about the office staff in here and online?
I think the biggest obstacle right now for us is the payer side of the equation, but we're trying to get around that in creative manners by forming partnerships. And one of our key partners in the Commonwealth of Kentucky is our Department of Agriculture. And our Ag Commissioner and I are the state co-chairs for Food as Medicine. So we have got to find other resources. And one of those is working with our local farmers, which economically benefits them to get their fresh fruits and vegetables and protein sources into our cafeterias, feeding our patients, feeding our employees, and it boosts them economically as well. So there are definitely barriers out there, but we have to just find creative solutions right now, and they're out there. There are people that want to partner and work with us.
Yeah, that's terrific. And Dion, same question for you. What would you like to see Congress or others do to help the benefits you're giving to Chicago and more broadly to really take off?
Well, I think we just have to ask ourselves, what is the metric of success? And I think that what we want to do is pay attention. I think that, as we were riding over in the Uber, when we were talking, a sobering thought that I had was that, although this room is packed and there are a lot of people online, this movement is wholly dependent on everyone here. So if we all disappeared right now, we would lose a lot of traction. We have to continue to connect it back to the ground to make sure that we can get legislation, that we can get it in black and white, because until we do that, we are still on borrowed time. And there is an immediacy that we all have to have that has to connect back to the immediacy and the people that we're trying to save. If we are saying that people are dying, that we cannot come to D.C. and act like they aren't dying. We have to keep up that momentum. We have to make sure we're connecting, and everybody should leave here asking yourself, what am I not doing, and who am I not supporting, or who am I not talking to?
Thank you, Dion. Kofi, same question for you, or if you want a different question, or 30 seconds. What would you like to see happen in Congress, or how would you like to see doctors be better trained and understand this better?
30 seconds. So I'm a doctor. We didn't get much training in food and nutrition. And the goal is not for MDs to become RDs, right? The goal is to build confidence, build awareness, build sort of the recognition of how we can then refer into all these programs. If we're building out this great infrastructure and doctors don't believe it's effective, we're losing out on that opportunity to build off of that trust with that patient-provider relationship. So it's critical that we invest in the education of providers, not again to become RDs, but to build this awareness and confidence and referral mechanism.
Yeah, and I think that should be across continuing medical education for practicing doctors, residencies, and medical schools. So Pam, you can have the closing word, 30 seconds. What would you like to see happen in the halls of Congress or the agencies or in states to really help us take off?
I mean, I think it's so exciting. And again, I'll repeat what I said, because I think it's really about transforming the way we treat and prevent diet-related disease and allowing our frontline care delivery teams, like what Kofi described, to have more tools in their tool belt to treat and prevent diet-related disease and address hunger in innovative ways. And so I look forward to a future where food as medicine is more woven into the fabric of healthcare in evidence-based ways. And also, I know there is so much innovation going on across the nation, and so I look forward to just it getting better and better as we move this work forward. I'm super excited about this future.
So big round of applause for this panel. Thank you.
What a great panel. Really wonderful. There'll be time to talk after Secretary Glickman. Thank you so much. Dari's going to stay where he is, and now it is my pleasure to introduce U.S. Member of Congress Vern Buchanan, who represents Florida's 16th Congressional District, and they are going to have a great fireside chat. Give them a round of applause, please.
So welcome to Congressman Vern Buchanan, who chairs the Ways and Means Subcommittee on Health. He's already proven himself a champion for thinking about food and nutrition through hearings, through actions. They're really trying to push Congress in a bipartisan way to really think about nutrition and health. So in your role as chairman of the Ways and Means Subcommittee on Health, you've really tried to prioritize policies that improve access to address nutrition and health. Why is this important to you? Why are you, caring about this as a member of Congress?
Well, I was kind of Maha before everybody else was Maha, but I'll say that up front. But
The Maha OG.
Yeah. But what happened in my situation, I'm like a lot of people, when you get in your 40s, your weight either goes up or down or whatever. And so I'm on this diet, that diet. So I finally started doing more and more research because people would tell me to do this and do that. And then I came up with the equation that I read in the book. And it was just simply, the top of the equation is the quality of the food. How is it real food? They measure it that way. And then the bottom part of the equation was calories. So what is the most nutritional food with the fewest calories? I lost 30 pounds and never looked back. I never had to think about it again because I made better choices. And now I see, I have 10 grandkids, 10 and under, and I'm so proud of my daughter-in-laws. I have 2 daughter-in-laws, 2 sons. They're very careful about what they're doing. So there's a lot of energy on this subject. People are finally really waking up. What is food? That's the question I have to ask you. But I know for my diet, it's a lot about plant-based foods as much as you can. And so there's a list you can pull from. And one guy measured every single food from top to bottom. Of course, broccoli and things are at the one side of it, and the other side, steamed broccoli and stuff. Ice cream might be on the other side. But I tell even my grandkids, I try to stay 80% more pure, more scientific, make better choices, and then I'll go out with the family like Memorial Day and we'll have fun. But I'm much more careful about it. The second thing is I try to encourage. Everybody has a different background, but I blue-collar kid out of Detroit, but I basically got into business many years ago, and it's important to set up the proper incentives that's one of my concerns about the industry. When you have fee-for-service, I don't know that's the right incentive for healthcare in general, and we're spending, $4.2 trillion on healthcare, and we're getting sicker as a society. So it's a lot of factors. So that's why I come back to, even when you say food is medicine, that sounds great, and I move that way, but the bottom line, you want to make sure it's good food, and it makes a lot of sense.
Yeah, absolutely. And I think your comment about never looking back, once you actually understand and can access and can afford and can cook healthy, minimally processed foods, it actually tastes better, it's easier, it's not harder, and many of the panelists earlier talked about that. And actually, I would put...
The thing is seasoning.
Good seasoning. I'd actually put ice cream kind of in the middle of that scale. Ice cream is actually a pretty healthy treat. It's got, some protein and some vitamins. I put bread, white bread, maybe at the bottom, white bread and candy. So I think it's terrific, your own personal story and your own commitment. You're one of the founding members of the Make America Healthy Again caucus, and I know that food is medicine is one of the planks of that. So can you talk a little bit about the caucus beyond your own role? What are the caucus's priorities here, and how is food is medicine going to play a role in what you want to do?
I think the food is medicine is one component. There's multiple, sleep and other things you can get into, but the 2 huge components is that and fitness. And even I had a doctor tell some of his patients, I'm in Sarasota, Florida, but they'd come down from the Midwest and Northeast, and he was a private physician. He's telling me that a lot of them come in, they're 65, they're on 5 pills, and he says to them, how would you like to get off those pills? He said, Doc, what do you mean? I can't. Would you like to get on them? He says, no, I can't. What are you saying? He said, I want you to start walking 2 miles a day, 5 days a week, and in a month, 6 weeks, I'll take you off probably half of what you're on. So it's a combination of really fitness, and we've got things we're doing in Congress, the FIT Act, that we're trying to do to make businesses and others more incentives for their employees. And I had, like I said, 1,200 employees, and you go look at our businesses, we have gyms in there and activity things because you get a better employee, and it's better for them, and it's better for their family. So I think those are the 2 big components. The other thing that concerns me is when you look at the whole thing, what's happening, diabetics and obesity. They say the average person is 60% of people are obese, and maybe it's 50%, take the number, whatever number you want. But the thing that's alarming to me, I mentioned I have 10 grandkids, is 20% of children are obese. That's a problem, not just today, but in the future. We're going in the wrong direction. So I'm very passionate about a lot of these different things, but it boils back down, and that's why I want to work with your organization and others about how we can move this forward. And even if we can just move it some, there'll be a big difference, because we can't keep afford paying the bills that we're paying out right now. We need people. And I'll say the other thing is, you need to be the CEO of your own health. You can't rely on all the other professionals. You got to be the CEO of your own health. And that to me, that mindset made a big difference. One basic thing I've always done since I was 40, someone talked me into it, is get a physical every year, January. Ideally, that's part of my New Year thing. And then maybe get tweaked here and there, some adjustments. But that makes a big difference. I'm very, very big on prevention. And, another friend of mine said to me that 50% of people who have their first heart attack don't see the next day. Now, that was a while back, but I thought to myself, how do I not get in that scenario in the first place? I don't like those odds. So there's a lot of things like cancer and heart disease and other things I think can be more minimized than where it's at. We can move in another direction. I'm convinced of that, not with everybody, but I think with most.
Yeah, as a cardiologist, I'll echo that. It's gotten a little bit better with urgent care and emergency rooms, but about 1 in 3 people who have their first heart attack die. So it's really, that's their wake-up call, is the last call they get. Those are still bad odds, yeah. And you mentioned children. I have a 12-year-old, a 14-year-old, and a 16-year-old, and I've explained to them, and my wife, who's in nutrition research as well, I've explained to them that the odds are stacked against them. They have almost a 2/3 lifetime risk of developing type 2 diabetes and a 2/3 lifetime risk of developing obesity, given the current trajectory that the nation is on. That's just unacceptable. They're more likely to be sick than to be healthy future in their life. So,
and that gets back, I just say with our family, the daughters and that, they're starting to watch more things, and the husbands and stuff. And there's more talk about it in various groups. And I'm so excited to hear that, because I was like a guy in the desert. They thought I was too far to write on some of this stuff. But it does make a big difference what's going on today, and we've got to do everything we can.
Yeah.
And that's why I'm going to have a lot more hearings. In fact, one hearing had the senator from Tennessee that came in, and he says, you know what, I've written a lot of prescriptions for, he was a heart surgeon. He said for surgeries and prescriptions and stuff like that. He said, after 30 years of practice, but I never wrote a prescription for food.
yeah, Senator Bill Frist. Yeah,
Bill Frist,
yeah.
Exactly.
So we've had 2 veterans on the panels earlier today who both either participated in or led food as medicine programs. I'm really, really, really excited about the legislation you introduced, really down to the details, to direct the Secretary of Veterans Affairs to establish and carry out demonstration programs to provide medically tailored meals and medically tailored groceries to eligible veterans. Can you talk about that bill and how it can help address the health of veterans in our nation?
I went in the Air Force when I was 18, and I remember they had an area where if you were way overweight over there. Now, it's like close to 30%. The young men, young women don't qualify, can't get into the service because of that. And it's to me, it's a national security issue just as well as anything. So we've got a bill that we've introduced to try to start working with a lot of different veterans in that, to try to get them in a better eating position. And a lot of times, like someone says, you can't eat it. If you eat a lot of the wrong stuff, it'll screw everything up in the fitness and everything else. So anyway, our bill, we've got a lot of co-sponsors on it. It's something we're passionately pushing with veterans and people looking to get in the military once they get in. And I feel very excited about that.
I think that's wonderful. And your committee last year, with over almost a unanimous majority, passed out the medically tailored meals in Medicare bill that has been championed by bipartisan, and I hope that will also be considered. I think the other group that's really important.
Medicaid, we've got to do something too.
Medicaid as well, yeah.
Well, we got to do something there.
I think the other group that we haven't talked about today, but we should mention since we talked about veterans, is the DoD, the Department of Defense, right? The warfighters should get the best possible food. Their families should get the best possible food. There's a lot of people who are actively serving in our military and their families who have diet-related chronic diseases. That should be completely outrage all of us and be sure that they get access to food as medicine.
They haven't been getting it, but we're going to change that.
Yeah, I think that's wonderful. Well, I thank you for your leadership on this issue, and thank you for coming in, and we really look forward, everyone in this room looks forward to working with you.
Thank you.
Yeah.
Appreciate it.
Thank you so much, Congresswoman. Thank you. Big round of applause for Dari, please. So to close out this afternoon's session, I'm honored, incredibly honored, to invite U.S. Member of Congress Chellie Pingree, who represents Maine's 1st Congressional District. Please give her a round of applause.
Thank you so much, Danny. Thank you to everybody in the room. Pleased to be here with all of you, and pleased to follow my my colleague, Mr. Buchanan, and to have this bipartisan kind of conversation about food as medicine. I'm just going to spend about 5 minutes talking, so I'll talk fast. And I know you're all here because this is a topic that interests you, and you've already covered a lot of it today. But you do understand that the top 10 causes of death in the United States are related to chronic diseases. Diet is such a big factor with these conditions, including type 2 diabetes and heart disease, some cancers and obesity. And it accounts for about 80% of the cost of our $3 trillion that our nation spends on health care every year. I could go a lot more into those details, but let me talk a little bit about where we are. I've been pleased to help launch the Bipartisan Food as Medicine Working Group, which has helped to highlight the importance of many of these issues, and bringing things like fresh produce into our system and the connection with proper nutrition. We've done some great things as a caucus, helped to raise awareness, working with both the House and the Senate. As a member of the Appropriations Committee, we've put funding into both the Indian Health Service and the VA to support a produce prescription program. Yay, thank you for everyone. I just came from an appropriations hearing. Now our job is just to protect all that money in the process. And also worked on programs like GusNIP, where we've tried to expand the produce prescription program. And I am excited and concerned and hopeful and all of the words you can possibly think about working with this new administration and their emphasis on MAHA. So I know that's a frequent topic for all of us, is how to make sure that we can find some aligned goals and those areas where we cross over. There are those people who are excited about what's going on with the SNAP waivers and encouraging more healthy eating there. There are people who are excited about the reduction in the use of food dyes. That's important as well. In the 2026 budget, we have $500 million that are planned for doing some of this future work and research. We're going to have this administration deciding on the dietary guidelines later in this year. So there are a lot of places that we're watching, that we're hoping we can work together, and that we're hoping that our goals actually truly do align. Now, I also have some concurrent concerns. So I spent many hours in the Agriculture Committee last week when we witnessed a considerable amount of money being cut from SNAP. So the danger in there is that the fundamental of making sure that people eat healthy food is that they actually get food. And as we know, it's about $6 a day. Thank you. Yeah. So we can't, on the one hand, say we're going to support some of these healthy food goals, yet take away the funding. It's about $6 per day per person. So a cut to SNAP means a likely reduction in that amount. And one of the things that we all know too well is eating healthy, having more fresh fruits and vegetables in your diet costs money. And so making sure that people have access to that funding is a deep concern to me, and making sure that we're not, on the one hand, proposing some awesome goals, yet reducing the funding in a way that can't happen. Some of the plans there are to reduce the funding to the states, so states will have to make that up. We've worked so hard to have federal priorities and goals for more healthy fruits and vegetables. We're not sure that that'll happen in every state, and we know that when funding is squeezed, often that's the place that doesn't get funding. We also lost SNAP Ed, SNAP Education, which goes beyond the SNAP program, but also to others to help people get that basic level of nutrition education. There are a lot of people who say, well, I want to eat more healthy, but I'm not exactly sure what that means and what to do or how to do it on an affordable budget. So losing SNAP Ed is a big concern. Also, a future reduction in the Thrifty Food Plan. The Thrifty Food Plan, for the wonks in the room, was how we were going to reevaluate SNAP costs over time and make sure that we were increasing costs as things cost more. Without that, the funding won't be there for those food cost increases. We're also dealing with a time of unprecedented food costs, so this is a challenge. We lost another $3 billion in the reconciliation plan that was going to some of the local produce acquisition. That was a wonderful program that had really started to increase the amount of food that was purchased locally for both school lunch programs and our food banks. Again, that's an expensive cost. I think we're all unified in the principle of buying more food locally, supporting American farmers. It took a long time to develop those connections and figure out how to effectively spend that money. So to have that program wiped out, it's another way of losing the opportunity to have fresh, healthy food at food banks and in school lunches. It also breaks the connection to those farmers who had contracts and are now deciding, like, do I really want to invest in producing more food locally? So I think that's harmful all along the way. There is a FDA-NIH joint initiative that has launched earlier this month to inform some policy around the research agenda. And I am all in favor of more research on how do ultra-processed foods harm people's health, how do food additives interfere with people's metabolic health and contribute to chronic diseases. There's a whole variety of good ideas out there, and I'm a big believer in the research. On the other side, we've lost one of our best food researchers at NIH. We're seeing severe cuts to NIH, and we're dealing with the 26 budget, which has deep cuts all along the way. So we're dealing with some contradictions here and have to figure out how to make sure that we continue to work on these important principles as we find our common ground on a topic that all of us consider really important. So I have my full dedication on this. I've been, we all like to say we were MAHA before there was MAHA, but I really was. I go back to the 70s as a back to the lander, so I really have the real creds on this of growing my own food. I've been an certified organic farmer for much of my life, and been a true believer of making sure that we have more healthy fruits and vegetables in our diet, that we have local farmers available to do this. I've worked on getting PFAS out of our soil and sustainable agriculture. I supported research to research the very question of does healthier soil produce healthier vegetables, and I hope that they don't deep sex that over at the USDA, but they're still working on that particular program. So I do think there's a lot of opportunities for this kind of collaboration. We're in the early days, really, of this administration. We're in the early days of seeing what will happen in the 2026 budget. We're trying to get some of this funding restored that we lost initially, and all those will be important components of moving forward. We're also looking for cross-the-aisle relationships, because I do think it's important that we talk to our colleagues about this on a one-on-one basis. How do we make sure that we're putting integrity behind our statements? And we've met with some of those people in our state who are very strongly in favor of the MAHA movement and made sure that we're looking for those areas that we have cross-cooperation. I'm lucky enough to serve on the Agriculture Committee as well as the Agriculture Appropriations Committee. We've already had some early meetings with the Secretary, and we'll continue to try to continue that relationship going and point out where we have consistencies and also where we have inconsistencies, because we don't want an administration that tries to take credit for some of these good ideas, but then really when it comes to the funding or the research or the hard work that we need to do, falls behind. So you have my full commitment on that. I really look forward to working with all of you. You're often our eyes and ears about where the funding is going and where it's not going. You're our advocates when we need people talking to our colleagues on the other side of the aisle who say, oh, wow, this is a great idea, but then don't always do the follow-through on what we have to vote for. And we are in an incredibly tricky time. We have never been faced with so many complicated issues between the DOGE reducing some of the funding, the reconciliation bill, which has sort of overtaken the farm bill, and a lot of the agricultural funding that we need to have done, as well as the Medicaid funding that's just critically important to keeping people healthy. And we're trying to work through a 2026 budget with an administration that doesn't always necessarily spend the money that appropriations gets them. And in fact, they're not even spending all the money that we gave them in the CR in 25. So you put all those layers together, and it's an unprecedented sort of funding, spending, authorizing moment in time. So it's going to take all armies present to get this work done. But I do believe there's some opportunities here. If we can get some good things done, if we can find some alignment of purpose, we have to do that. And I'll look forward to working with all of you to do that. So I'm going to head out to vote, but I really appreciate all of you being here, and thank you so much for your time. Thank you.
A huge thank you to Congresswoman Pingree, a true food and agriculture heroine and somebody who actually works across the aisle and does it well. I want to thank all of today's speakers for joining us. It's really inspiring to hear about all of the progress being made in food as medicine and the opportunities to scale it. And while I am excited, I am very concerned about budget cuts and cuts to agencies like USDA, HHS, and USAID. So hopefully things will turn around for the better. Thank you to everyone who joined us online and in person. There's a lot of food in the back of the room. Please don't waste food. Another big thanks to our partners and collaborators and co-conspirators at the Food as Medicine Institute. Please give them a round of applause. Another big thanks to the Capitol Hill staff and catering for providing such a delicious lunch and making this event possible. Please give them a round of applause. Thank you to Ricky Lasser for live streaming today's event. Please give him a round of applause. And none of this would happen without the food tank team, including my co-founder Bernard Pollock, Elena Seeley, Kenzie Wade, Jessica Levy, Anthony Nicome, and John Alexander for all of their work behind the scenes. Give them a round of applause. Thank you all again, and we look forward to having more of these conversations very soon. Give yourselves a round of applause.